Η σημερινή μας εκπομπή είναι αφιερωμένη στην υγεία. Έχουμε κοντά μας τρεις πολύ σημαντικούς Έλληνες γιατρούς που διαπρέπουν εδώ και πάρα πολλά χρόνια στη Νέα Υόρκη. Good morning, everyone, and welcome to today's episode, which is dedicated to health. We have three of the most renowned Greek doctors of New York City, Dr. Konstantin Plestis, Dr. Neo Stefanidis, and Dr. Pirio Patetsios. Gentlemen, welcome to our show. Thank you for being here with us.
Thank you for having us.
A world-renowned doctor and leader in the field of thoracic and cardiac surgery, Dr. Konstantinos Plestis is no stranger to the new Greek TV audience. The director of Lenox Hill Aortic Program, we are very thrilled to have with us on our panel, Dr. Plestis. A sports medicine doctor, Dr. Neo Stefanidis, is an expert in shoulder and knee reconstruction. And an expert in vascular surgery with over 20 years' experience, Dr. Pirio Patetsios joins us with our panel as well. Gentlemen, thank you again.
Thank you.
There's a lot of topics that need attention and a lot of discussion, but unfortunately we won't have a lot of time. But on this show, we would like to give some information and some advice to our viewers about the general calendar of health is what we would like to call it on our show. We can start with Dr. Plestis. Your specialty, of course, is cardiac surgery, Dr. Plestis, and we would like to know what are some of the things that can prevent cardiac disease?
I mean, cardiac disease is endemic in the 21st century, as you know, Yana, and there are certain issues, primarily with obesity, smoking, and high blood pressure, I would say, that they are of paramount importance in terms of preventing cardiovascular diseases as long as you take care of these issues. So, for example, losing weight, exercising, taking the medication so somebody can take care of the blood pressure, and making sure that the weight is good. I think they are extremely important to maintain good health for these individuals for many years.
It varies from men to women, but what age should men really start taking care of their health?
I think atherosclerosis, which is the disease of the arteries of the heart and of the blood vessels of the entire body, starts when we are born. You know, because we have to get older and eventually die at some point.
I think he agrees with me. Is agreeing, of course, vascular surgeon.
He's a vascular surgeon. I think he will tell us more about that. But at the end of the day, as long as there is no significant family history of coronary artery disease, I think men around 45 to 50 years old, they have to seriously go to the doctor, make sure that they have a stress test, make sure they have an EKG, and as I said, check the cholesterol, make sure that they are not obese, and if they are diabetics, they have to control the sugar. So between 45 and 50, I think it's a good age to start. That does not mean that you have to abuse yourself at younger ages. So, you know, we have to use what the ancient Greeks said, that everything has to be, you know, it has to be a medium, you know, in everything in life, of course.
And so what if they start feeling pains in their heart? What are some of the signs that people should be aware of that they might be having some heart problems?
So the most common sign, and the sign that a lot of people complain of, is angina pain, which means pain in the middle of the chest that radiates all the way to the back.
I think that sounds familiar. A lot of people are suffering from stress today, and I've heard that amongst a lot of the professionals. Oh, my chest hurts. Oh, I have a lot of stress. I can't breathe.
You know, yes, the chest pain is a very common symptom, but if it is persistent, if it is localized in the chest and goes to the back and the left arm, and also if it's reproducible, meaning that if you walk and you get chest pain, then that to me is a very important thing. You have to go to the doctor and check it out.
As you're walking, you mean exercising during exercise?
As you are walking. Walking is a form of exercise. You can have, you can exercise on the treadmill, you can walk, you can run, and so forth and so on. But if you walk or if you exercise and you develop chest pain, I think one has to really pay significant attention to that and go to the physician and be checked out with that.
I'd like to move on to Dr. Patetsios for a second because we're on this topic. People don't pay attention to their veins enough. And of course, the arteries. And so what is it that we need to know about our arteries and our veins?
Well, to reiterate what Dr. Plestis said, number one is preventative measures for the arteries. Now we're going to talk about the arteries. Prevent hypertension, family history, smoking, and again, cholesterol. To reiterate again what he said about early age atherosclerosis, I do agree it starts when you're born. I've seen patients in their 30s who have significant atherosclerosis. And what I see a lot nowadays is with the young population, a lot of them smoke. And they don't realize that in the long run, that's not good for your arteries. So I do recommend exercise, and I do recommend a checkup with your primary care doctor, who will probably refer you to a cardiologist or refer you to a vascular surgeon or a thoracic surgeon if you do need it. But in terms of arteries, I just preventative measures, exercise, and watch your weight, cholesterol, and hypertension. Now, veins are a different story. Most people nowadays do suffer from pain with their veins. Everybody says that veins are cosmetic. People who have varicose veins are people who are born with them. There could be a genetic predisposition to varicose veins, people who stand for a long period of time.
And what causes the varicose veins to come out?
The veins have valves, and the valves in the veins bring the blood up to the heart. So when the valves break over time, instead of the blood going up, it goes down, and the veins break. And then you see these clusters of veins in your legs. They look, some people, as they say, they look ugly. And these are called varicose veins. And you could suffer from varicose veins. You can get what we call venous claudication, where your legs feel very heavy and tired. Or you can get phlebitis, where the vein clots up and you get some redness in the area, and that can be making you go to the hospital and have IV antibiotics.
Are these risk factors for any sort of health problems, including cardiac problems?
I would say veins, not necessarily, but arteries, absolutely. There is a link between what we call claudication, bad blood supply to the legs, with heart disease. At least 10% of the population who has claudication has heart disease.
So what would you like to tell our viewers about some risk factors or things to be aware of if they see some signs of abnormality with their veins?
Well, with their veins is if they get phlebitis, if they get redness of the skin in the area, the legs feel very heavy, and just tiredness of the legs.
Pain and tired if they...
That's basically it.
And this is, when they do feel that, it's time for them to come see a doctor?
When they do feel that, it's time to see a vascular surgeon or a person who takes care of veins. And nowadays, we use lasers, and the treatment is totally different from what it was 10, 15 years ago, where we used to open...
For all veins?
All veins. It's all laser treatment, and the results have been quite well.
Is there downtime on those?
Nope, no downtime. You come in, a 25-minute procedure, you go home the same day, you can go to work the next day.
And does that also improve your health and your blood flow?
Oh, absolutely. Absolutely. I feel it does, but make sure you're taking the vein out for the right reasons.
Now, going back to that big aorta from the leg going up to the heart, Dr. Stefanidis, orthopedic surgeon, one of the best, is going to tell us a little bit about some signs of orthopedic problems that people might have that they're not aware of.
The most common problems that I find in my office, most patients come in with either shoulder pain, knee pain, or back pain. Back pain probably makes up about 50% of my practice, so it is a very common problem. Any pains that don't resolve on their own within a couple of weeks, you should go see your orthopedic surgeon and get evaluated just to make sure that there's nothing serious going on.
And what are some things that people might be doing at home that are causing these problems? Even sedentary people, they're just daily tasks that might cause herniated discs, because they say that everyone's going to have at least 2 to 3 herniated discs in their lifetime. What does that mean? I don't wish upon anyone, because I have a couple of them.
I mean, and lifting heavy objects, poor posture, lifting heavy objects, using your back and not using your legs to lift them up, a mattress, which should be changed probably every 5 to 10 years.
That's something that people don't realize, how important a mattress is for your health.
Very important. I tell all my patients with back issues to make sure that they have an appropriate mattress and that it's not too old. Something supportive, something firm is usually the best.
And they might come to you with a pain in their leg, and the aortic valve, the vena cava, is that the big one that goes up to the heart from the leg? That many people have a lot of weight gain around their stomach. Men have a lot of, men who do have a lot of fat around their abdominal area. The circumference is, if it's, they say, bigger than your chest, is a problem. And what kind of problems will we see there, doctor?
I'm not sure exactly the relationship between the obesity and the vena cava, but I think you may be able to tell us more about problems with the inferior vena cava and...
Well, they get compression. The vena cava is a big vein that's underneath the stomach, as we call the stomach in the belly area. So when you're obese and when you're lying down, you're putting pressure on the vena cava. And that's another reason why people could develop varicose veins, because you're putting a lot of pressure on the major vein.
And that would cause heart problems as well, doctor?
It's going to cause problems from the veins, but it's not going to cause problems from the heart.
What about the abdominal area that has so much fat? That fat, does it cause some sort of
That is an indication of significant atherosclerosis and significant burden of the heart, and definitely can affect the heart function because the heart has to push a lot of blood through the fat. So the presence of fat has multiple consequences, for these patients, including what it was mentioned earlier on with the varicose veins, including a significant burden of the heart function. And of course, this is an indication that the patients may have significant atherosclerosis of the arteries of the heart.
The obesity, there's a thing called metabolic syndrome. A lot of the endocrinologists know about it. With the obesity, they develop a resistance to insulin. So you can develop diabetes from the obesity. Not only that, your pancreas develops a resistance to sugar. So that's another issue with the stomach area. And your endocrinologist can tell you more details, but those are risk factors for, as Dr. Plessis says, for atherosclerotic disease.
Back to Dr. Stefanidis. Can veins be compromised due to muscular injuries or some sort of injuries in the skeletal?
Most commonly what I find in my office, people with venous problems, obesity can cause what's called venous stasis. Inactivity can cause venous stasis and cause the blood to pool in the legs, which can make the legs swell, and that could cause pain. And so maintenance of a normal weight, regular exercise can prevent a lot of these issues.
So, gentlemen, I want you to recap here to our audience about what type of signals they should be watching out for and when they should come see you guys. We're going to start with Dr. Plestis.
Yeah, for the heart disease, and I have to say something that was said earlier on, heart disease and vascular disease goes hand in hand.
Hand in hand.
Because it affects, atherosclerosis affects both systems simultaneously. So for the heart problems, it's chest pain in the middle of the chest, radiating to the back.
How do we know that that's not from stress and that's not a cardiac problem?
If this pain keeps coming and it's severe.
How often are the signs of it leading to some sort of problem in the heart?
Usually this pain is a reproducible pain, particularly when you walk or when you exercise.
How about when you're in the office and you're stressed out and you have pain in your chest? I'm saying this because I have experienced it with a lot of people around me. My chest hurts, or when people are upset or they're fighting, my chest hurts.
So
I'm one of them.
Let me put it that way. Usually, if you are in the 30s and 40s, it's rather unusual, this pain to be associated with coronary artery disease. Not that it cannot happen. It can happen, but it's very unusual. The angina pain is a very severe chest pain. It's 10 out of 10. People will not miss that pain for a different type of pain.
And that pain radiates down to the arm and the back?
The pain goes to the back and then it radiates to the left arm. Or it can go up to the jaw here. So if you have a serious pain, a severe chest pain, I can assure you that most of the people who experience that type of pain, they know that there is something wrong with them. And let me put it that way to you. Let's say that you are not sure about that. Let's say that there is a situation where a patient, young or old, whatever it is, says, I'm not sure about that. I think if you have several of these episodes, you should go to a cardiologist to be checked out.
Immediately. Dr. Plestis, immediately.
Immediately. You get an EKG, you can do a stress test. There are ways to rule out that type of problem.
Can we tell our viewers a little bit about the difference of a stroke and a heart attack?
No, a stroke, you're having a blood clot or an occlusion of a vessel in the brain. So you are losing part of the brain, and I think the vascular surgeon can give us more information about that.
Give us your risk factors and how to be able to
identify a stroke.
Identify a stroke.
Well, risk factors, again, are the same risk factors for all types of atherosclerotic disease. Again, hypertension, smoking, diabetes, and also heart disease. Basically, what a stroke is area of the brain does not get blood flow. A blood vessel could break from hypertension, or it can clog up, and it can cause a significant damage. The other thing you have to note is the carotid arteries that go to the brain. As a vascular surgeon, we always analyze these, because if there's significant blockage of the arteries going to the brain, the carotid artery, those can be treated medically, or if they're really significant, they can be treated surgically or with stents. Dr.
Stefanidis, prevention and a list of problems or the way people feel that they should come see you if they are feeling pains that aren't natural.
Prevention of orthopedic issues, regular exercise, maintenance of a normal weight, and with exercise you want to include not only aerobic exercise but also weight training.
And stretching.
And stretching, of course. And anything that you should be worried about, any pain that's unrelenting, meaning that any pain that does not go away within a couple of weeks on its own, should be evaluated by your doctor. Any pains that cause you night pains that would make you wake up at night, or night sweats, or unexplained weight loss, you should be evaluated immediately.
Well, gentlemen, we'd like to thank you for this wonderful, important information that we gave our viewers today. Where can someone find you, Dr. Plesty? Where is your practice?
My practice is in Manhattan, as you know. I work at Lenox Hill Hospital.
By the way, everyone loves Dr. Plesty. He happens to be our famous doctor show host.
Yeah, you know, it's a pleasure to be here. And actually, I have to thank you and the owners of this station, because you have done a wonderful job, and to include physicians in your programs, because it gives an opportunity for physicians to communicate with the Greek community, exchange ideas, and we have wonderful doctors, as you can see from the panel for tonight.
Yes, the
well-known
Greeks
physicians.
are in high places, and they're saving lives.
They're saving lives, absolutely. So I work in Manhattan at Lenox Hill Hospital, which is 130 East 77 Street in between Park and Lex.
Dr. Stefanidis, if someone doesn't feel well, their body hurts, and that pain doesn't go away, where can they come find you?
I have offices in Queens and Long Island. Astoria, I have an office in Astoria, one in Bayside, and in Long Island I can be found in Garden City.
Dr. Patetsios?
I could be found in Great Neck, New York. I practice at St. Francis Hospital. I'm on 900 Northern Boulevard, and I'll be more than happy to see everybody.
Well, we're very happy to have had you. We're going to have you on our panel again. Ladies and gentlemen, Greek doctors, Greek-American doctors that are saving lives on a daily basis here in the United States. We're very proud of them. They're doing a lot for our Hellenic American community as well. We're going to take a short commercial break and be right back for more.
Τώρα η ομορφιά δεν απαιτεί θυσίες. Στο The Face and Body Shop θα αποκτήσετε την ομορφιά και τη λάμψη που αξίζετε. Χρησιμοποιούμε μόνο βιολογικά προϊόντα στις βαφές μαλλιών, την αποτρίχωση και τον καθαρισμό προσώπου. Μοναδικά αποτελέσματα στη θεραπεία κυταρίτιδας και λέιζερ. The Face and Body Shop. Εμπιστευτείτε μας σήμερα κιόλας. Διεύθυνση 4021 23 Avenue, Αστόρια, και τηλέφωνο 718 204 9390. Αναλαμβάνουμε την περιποίηση για τις μικρές πριγκίπισσες στα παιδικά πάρτι.
And now, our dermatologist, Dr. Athena Kapouris, is going to give us some dry skincare tips.
Hi, I'm Dr. Athena Kapouris, a board-certified dermatologist, and I'm here to talk to you a little bit about dry skincare and eczema skincare. It is not uncommon for skin to dry out. We see skin dry out for a variety of reasons. It can dry out in the summer from being out in the sun too long and being dehydrated, and if you get a sunburn, it can dry out in the winter just because of the dry indoor heating. Now, how do we treat this? One thing is that you should limit your shower time. Short showers are very helpful. Long showers and long baths actually dry out the skin. When you get out of the shower, it's good to apply moisturizer. You don't have to dry yourself completely. The skin could be left just a little damp, and then you can apply a bland moisturizer. There are many brands on the market that are excellent moisturizers. Aveeno, Eucerin, Cetaphil, CeraVe. These are all great brands that are fairly inexpensive and easy to find. If you have a persistent dry area that's rough, you can also try to self-treat it with a little over-the-counter hydrocortisone. 1% hydrocortisone is easily found in any pharmacy, and it's over-the-counter, and you do not need a prescription. That can be very helpful. Should you try these things and you have a persistent rough spot, a persistent irritated spot, then it's time to make an appointment and see your local dermatologist.
Hair on 14th, a full-service salon that has a professional staff committed to providing a sophisticated, warm environment. Our expert stylists use the best products available in the beauty industry today. Come experience our superior techniques in highlights, color, cutting, styling, and more. Our Euro Laser Clinic has certified laser specialists that remove unwanted hair utilizing the Zimmer cooling method. JD Opticians, luxury eyewear that keeps your budget in sight. Premier European designers, Chanel, Bulgari, Tiffany, Oliver Peoples, Versace, and more. Personal service prescription eyewear, why you wait? We speak Greek, μιλάμε ελληνικά. Trust your eyes to the specialist JD Opticians for all your optical needs. 15255 10th Avenue, Whitestone, New York, 718-747-2470.
Να περάσουμε τώρα σε μια πολύ γνωστή Ελληνοαμερικανίδα επιστήμονα που αποτελεί ένα σημαντικό κεφάλαιο για την ομογένεια. Είναι η Ellen Manos από το Lenox Hill Hospital. Dr. Ellen Manos is an obstetrician and gynecologist specializing in female reproductive health. Affiliated with Lenox Hill Hospital, Dr. Manos is one of the leading OBGYNs in New York City today and has been practicing for over 31 years. Dr. Manos, thank you so much for being with us.
Delighted to be here. Thank you for having me.
All the girls are lined up in the control room and they're listening to what you have to say, and I'm sure all our viewers are as well.
Terrific. Thank
We had
you.
a lot of great topics today that we've been talking about with our doctors panel, and one of the biggest topics is gynecology.
Right.
We would love to know, what is the perfect calendar of health that we should all have on our refrigerator? Women should have a calendar of health, a list of exams that they must do annually.
Right. I think that's a really great way of saying it. And by the way, thank you so much for having me on this English-speaking show, because my Greek is not bad. But the fact is, to communicate in English, to get across to this new population, my daughter is 20 years old, speaks a bit of Greek, but is really, as a Greek American woman, would absolutely love this kind of program.
Oh, thank
so
you.
I think it's really going to fill a great need. So thank you for having me part of it.
Thank you. These are great words. Thank you. Your support is greatly appreciated.
And as far as that calendar of health, it's a great expression. It's something that probably every woman should start thinking about, even in their middle teen years.
So when they start getting their period?
Well, when they start getting their period, they just have to be aware of what's happening to their bodies, because certainly in the routine kind of world where you're having regular periods, you really don't have pain, you're feeling pretty good about yourself, you don't really have to get involved with a gynecologist quite yet. But what I like to see is that in between, when they're between 15 and 17, they're a little too old to go to their pediatricians, and they're a little too young to have their own gynecologist. So often they're the kids that I've delivered. Their mothers will bring them in.
That's great.
And we start them off on routines, like you're saying.
Yes.
Talk about examining your own breasts. Know about nutrition. Know about good health issues like
Pap smears.
Staying healthy, Pap smears later on, because when they're teenagers that age, they probably don't need it.
Okay.
Getting the proper vaccines, and the HPV vaccine, maybe we'll touch on that later,
I would
because
love to,
that's
yes.
really
It's
important.
a big hot topic.
But once they get into their teens and 20s, and certainly if they are sexually active, they have got to be on a regular routine of women's health care.
And birth control?
And birth control. I mean, certainly, even if you're not sexually active and if you're a woman who needs regular care, you should be going to the gynecologist once a year. Once a year is absolutely a must for any woman. And that's important not only for a Pap smear, but a thyroid exam. Who checks your thyroid? I mean, your internist may.
I've never had my thyroid checked.
Well, we palpate, we feel, we look. Thyroid cancer is the #1 cancer amongst ages 18 to 28. #1. So thyroid should be checked, breast should be checked, abdomen should be checked, the Pap smear should be done, and a full pelvic exam.
Yes, people overlook that. Full pelvic exams. We don't do ultrasounds for the uterus and the ovaries. We really don't pay attention to that, and colonoscopies aren't done enough.
Well, I mean, it's great to go to your general internist or your primary care physician or your GP. They can do an exam. They sometimes even try to do your Pap smears, and they'll ask you, do you want me to do it out of convenience? And sure, a lot of women will do it out of convenience, but they're not getting the full exam.
Right.
A full pelvic exam, bimanual, 2 hands. We check the uterus, we check the ovaries. This lets us feel if there's anything abnormal, then we know to send you for the pelvic ultrasound, to be sure you don't have fibroids, to be sure your ovaries are normal. And a rectal exam. It's amazing to me, after 26 years of private practice, 5 years of training, as you said, 31 years, how many women who will come to me for the first time and say, you know, I've never had this kind of exam before, a rectal exam,
Right.
as part of the pelvic. And at a certain age, certainly Over the age of 30, it should be done yearly. Younger than that, we're flexible. But it tells you a lot of information about the anatomy behind the uterus: endometriosis, ovarian cysts, and later on, ovarian cancer. These are things that we can find out about through this kind of full pelvic exam.
On that note, give us some signs of endometriosis.
Yeah, endometriosis is tricky because it's one of those strange conditions where you can have one drop and have terrible pain, and you can have lots of it and have no symptoms. So that's another reason why when you go to your gynecologist, if they feel little lumpy bumps or nodularity, we call it nodularity on the exam.
Is that polycystic or no?
It could be polycystic ovaries, but it also could be endometriosis. And the classic signs of endometriosis can be irregular bleeding, can be very painful periods, cramping in between, and a lot of other kind of mood situations. PMS may be a little more common with patients with endometriosis. But just because you don't have those symptoms, if the exam is abnormal, it's one of the things that we have to rule out.
Is this an exam that you have to ask the doctor to do, or our gynecologists, they do the exam regardless of whether it's asked or not?
Well, I think half of the exam is a good history. If your gynecologist is an interested doctor, they're not just going to say, hello, let's do your exam, do the pap smear. They're going to talk to you. Have your periods been regular? Have they been the same the last 2 to 3 years? What has changed? Are you suddenly having pain? Are you suddenly having irregular bleeding? If you're sexually active, do certain positions of intercourse affect you in a bad way? Do you have pain? Do you have pain when you have a bowel movement? These are all these things
Signs.
that
There are many signs that we're not, we think that they're natural, but you should be bringing them up to your doctor. Hey, you know what? I have this pain.
History is a really important part of the exam. There's nothing worse than a doctor who doesn't connect with the patient. If you're sitting there on a computer, inputting information on a computer and not even looking at your patient, to me, there's something wrong. You have to know
you heard
your
it from a
patients.
doctor, how your
Well,
doctor should be treating you when you
Yes,
visit.
for sure.
Tell us about HPV. This is the latest that's out there. I mean, it's been out there for a couple of years, but women need to get more informed about what that is.
Yeah, HPV has been around a very long time, but of course it's been really noted and investigated over the past 20 years. And it's a virus. It's HPV is human papilloma virus. There's a host of them, many, 55 types, if not more. But the 4 that are really important. Yeah, it's contracted usually from contact. And when we say contact, it could be sexually transmissible, but also skin-to-skin contact. So even people that aren't fully sexually active, and I suppose it's hard to make that definition.
They're intimate, but
even if you're not having full sexual activity, you can also contract this. Contact, skin-to-skin, membrane-to-membrane. Having said that, 79 million people in this country have the HPV virus, and 14 million per year are getting new infections. So it's really important for us as gynecologists, as parents, as women, to protect ourselves and our progeny. So now that we have this vaccine, the one that's quadrivalent, it protects against the 4 most important types. It's called the Gardasil vaccine. And there's others out there too. It's so important to discuss it with your spouse or your significant other, with your pediatrician, with your gynecologist, because it really is a fantastic means of preventing cervical cancer and infection with HPV. It doesn't substitute for behavior.
Right,
of course not.
Of course. But this is something new. I mean, what is it that has caused this virus?
I don't know that it's a new virus. I think more likely it's that we know how to, technology is advanced that we're picking it up. Exactly. And now that we know how to screen for it in women, of course we can screen for it with the pap smear and with any tissue. With men, it's hard to screen for because there's no male pap smear.
Right.
So since 2011,
they should do something for men.
We wish we could, but since 2011, the vaccine has been approved for use in both men and women. And right in the news last week, I mean, this is perfect timing, Jana. They've shown, the CDC, the Center of Disease Control in Washington, has put out a report that said this vaccine is better than expected. In the past 4 years, it's cut the incidence of HPV in half amongst the 14 to 19-year-olds, which is where you really want to catch it before they get too old and get diseases, and certainly before they're sexually active.
Do we get rid of this virus? Is there a therapy that gets rid of it? I mean, if you can't, let's say you haven't prevented it and you have it. Is there a treatment for it?
Well, unfortunately, the answer is no. There's a treatment once it's become incorporated into the cells. If it already makes your cells abnormal, dysplasia, the word dysplasia means precancer. So once the cells become precancerous, yes, we can treat them and we can cure it. But the carrier state, the HPV carrier state, is not treatable. It's only immune system, boosting the immune system, telling your young teenagers to sleep more, don't smoke cigarettes, don't drink a lot of alcohol, eat the green vegetables, eat the Mediterranean diet, listen to what your parents and your mother and your grandmother are telling you. Sounds familiar, doesn't it?
They're telling you not to have contact.
Well, and also to abstain, that's right, and use condoms and abstain. Delay is really important for any man or woman. Having said that, look, teenagers, young adults, eventually when they become sexually active, you want them to be protected. So it's good health measures, but this vaccine is fantastic. The problem with the vaccine is it's a little expensive and it's 3 shots. You have to do it a month apart, or actually the first 2 are 2 months apart, and then a booster. So we see a lot of teenagers who'll get the first shot and then not get the rest.
But it is a necessity. It is a necessity.
And the first shot is 80% effective.
Now, do they need to ask you for a specific test, or is this something that comes up in the pap smear?
The HPV will come up in the pap smear, yes. The majority of pap smears nowadays will do an automatic HPV.
And if they should we ask for, I mean, just to make sure,
well,
should the patient be saying, oh, will this test for HPV?
I think the client, or as you said, the patient should ask the doctor, is my pap smear going to include a screen for HPV? Obviously, they should also be asking, can I get the vaccine? Am I a candidate? Even if you're an older teenager, young adult, because certainly the whole success would be as if we could get all young boys and girls vaccinated. Australia, 85%, and boys. It's been approved since 2011.
Now, this vaccine, who are the candidates for this vaccine?
Any child from the age of 9 to 26 years old. Now, of course, 9 years old, you say, why would we want to vaccinate somebody at 9 years old? Well, the pediatricians are vaccinating them for hepatitis B. Hepatitis B is also contracted through blood and sexual intercourse. And everybody's getting vaccinated, even little babies in the hospitals, they are vaccinating them. So what are we doing? We're wiping out hepatitis B, we're wiping out liver cancer. It's fantastic. This is similar. So they want to start it at a young age, so you're not even thinking about the sex thing, you're thinking about protecting them against cervical and other anal rectal cancers. Look at this famous actor who just came out telling about his throat cancer. His throat cancer is Michael Douglas. His throat cancer is HPV related.
Oh my God.
And we don't know why, in his case particularly, I know nothing about his history, but these are the kind of cancers in the throat and in other parts of the genital tract that are going to be prevented, male and female. Now, it's fantastic.
If someone does have HPV, should they be telling their partner, because their partner will have it eventually?
Well, again, it's a matter of whether there's already some disease state or it's just the carrier state. The carrier state's tricky because you can live with it forever and it doesn't necessarily mean you're going to get a cancer just because you carry it. And again, if your immune system's good and you can fight it, you can become HPV negative, which is even better.
Let's go into, let's talk a little bit about cancer. High risks versus low risks. Give us some. Yeah. Give us the list.
And again, it's
of the risk factors.
Important in the literature and the news right now. We have Angelina Jolie talking about her breast ovarian cancer gene. That is very small subset of cancers. Of course, the genetic ones that are carried. And it's a fantastic way of knowing. It's a fantastic way of getting histories again, talking to your patients, seeing if there's a cancer cluster. More importantly are the cancers that aren't genetically related, because these are things that we can really affect on a day-to-day basis. Thyroid, breast, uterine, ovarian cancer.
Prostate
for men. Anal cancers for men.
Right.
These things are very important and very important to bring up on a routine basis as part of your schedule. So women over the age of 35, should they have their first mammogram? Well, it depends on their history. If mom had early breast cancer, or if there's a family history of early breast cancer, we as gynecologists will tell our patients, get that first one at 35, or even younger if we feel something. After 40, for sure, you should have your first one and then every year to 2 years after that. And again, we have a little bit of flexibility here because you have to decide what's best for that exact patient. Now other cancers, uterine, ovarian, that is flexible also, depending on the exam, family history.
And all these tests will determine, God forbid, if there is something there.
Uterine cancer, thankfully, can be caught very early. Ovarian cancer is the scary one, where we hear stories that you can't pick it up.
And intestinal.
And intestinal, colon cancer. And of course, women get colon cancer just like men get colon cancer. So colonoscopies from age 50 on, very important. Before 50, depends on your family history. What if your papu or if your mom had colon polyps? That tells us that you're higher risk for developing colon polyps and cancer.
Right.
So then we have to say, gee, maybe you need your colonoscopy not at 50, maybe at 40. So we gynecologists are kind of like,
you have to be.
People.
Yes, you are very important people, but you also have to create that awareness to your patients. Now, going back to Angelina Jolie, there's been a lot of controversy around her mastectomy, and she was predisposed.
Right.
Tell me what your thoughts are about her decision.
Well, I think it was a very proper decision in her case and a very brave decision in her case. When you look at her as a public figure, and the way that her words have a lot of power, as do her actions, and the fact that she has a lot of children and she wants to live a long life to see them grow up. So for lots of reasons, she did what she did. Her mother died, I think, before she could be tested. And of course, the person who's affected with the breast cancer is the one that should be tested for this BRCA gene. And since she didn't know, she went ahead and got tested herself, and unfortunately found out that she was positive for the BRCA1 and 2. Wow. So when you're positive for those and you have a 70% lifetime risk of developing breast or ovarian cancer, that's incredible. If you know that you're going to develop these cancers and you have this family and you can do something about it, she went ahead and decided to do the bilateral mastectomy. And she may decide later on to take her ovaries out, which also is indicated, but not when you're terribly young. I mean, don't forget the ovaries are very good organs. They give us female hormones, and that estrogen keeps us healthy.
Up to a certain age, and I want to we have so much to talk about, we can't really cover everything, but I do want to cover a little bit about on fertility.
Yes.
I know that we were saying in one of the shows, today's 50 is like today's 40, but that's not really the case when it comes to our biological clock.
Yeah, unfortunately.
So enlighten us a little bit about what's going on with fertility and with today's technology.
Yeah, it's as you say, Yana, it's true. We may feel like $1 million, but our ovaries do age. And unfortunately, the ovaries are usually the limiting factor. Those eggs are the limiting factor. And they are healthy and wonderful from the time you're starting to menstruate at 12, 13 years old until you hit about 35. And of course, year to year through your teenage and 20s, fertility rates drop, the quality of the eggs drop, but by very little. Once you hit 35, the quality of the eggs and fertility rates as a direct response do drop. And they drop more at 37 and more after 40. That's not to say we can't have healthy babies over 40. It's just statistically, it's a little less so.
And what are the risk factors when women are pregnant between the ages of 40 and 47?
Well, assuming they get pregnant and assuming that they stay pregnant, because of course the miscarriage rate is a little higher as a result. It's almost nature's way of telling you it's not a great pregnancy. We just need to be sure that these embryos or fetuses are genetically normal. And the technology nowadays can give us that answer pretty early on at about 10.5 to 12 weeks. The problem is we have to wait till 10.5 to 12 weeks.
To find out.
So you're joyous that you're pregnant and you're still sitting on pins and needles for 3 months.
Yes.
Of course, health issues aside, you want to stay healthy, make sure you're taking your vitamins, taking your vitamin D, which has been implicated right now in healthy pregnancies.
Wow.
None of us want to sit in the sun anymore. We don't want wrinkles, we don't want skin cancer, but guess what? We're vitamin D deficient.
Yes.
And that's important for brain, for bones, for your colon, and now we see for pregnancy that it's very important to take vitamin D and keep your level normal.
What other vitamins should women be taking for overall health? Vitamin D?
Vitamin D for sure. If you're a heavy bleeder, you should be taking iron or doing iron-rich foods, depending on what kind of bleeding pattern you have with your periods. When you're planning on getting pregnant, taking folic acid, which is a B vitamin, very important. But aside from pregnancy, in general, if women are healthy eaters, which is a whole other discussion, especially with busy working women like we are. We tend to skip meals, we drink a lot of coffee, and I'm a great fan of coffee, but the fact is these things don't substitute for eating well. So if you're a healthy eater, a multivitamin and a vitamin D is probably the minimum that you should do. As we get older, taking CoQ10 for our immune systems, taking vitamin E or fish oils are fantastic, again, for immune system, keeping us healthy.
Omega-3s.
Omega-3s. And the Greeks have known this forever.
Yes, that's why we are kind of, they say that we're young. I mean, we have good genetics, but I do think it's also the nutrition and...
Absolutely, and not smoking. And the sun, and not smoking.
Yeah.
If you're a smoker, unfortunately, a lot of this goes by the wayside because the smoking takes away so much from all the other good things that you may be doing. And the same thing with HPV and viruses, by the way. If you're a smoker, you have a 20-time increased risk of recurrence.
Wow.
So,
Doctor, you've given us a lot of wonderful information. It's not enough for one show. We have to bring you back. And
does that mean you're going to invite me back?
Yes, I will.
Thank you.
We love having you here.
Thank you
and I'm
so
sure
much.
all our viewers enjoyed all your wonderful, wonderful information.
Excellent.
Thank you so much. Thank you, and I'm sure the viewers thank you. Where can someone reach you if they would like to come and see you?
Oh, well, that's fantastic. I mean, I'm listed in the book. My private practice is on 63rd Street between Lexington and Park Avenue. And I would be thrilled to see my Greek American fellow women, and non-Greek American, of course, but it's a need, and we need to stick together and improve women's health for lots of reasons.
Thank you.
Thank you. Thank you so much for having me.
Ο Dr. Peter Πατέτσιος είναι board certified γενικός ενδοκηχειρουργός και συνεργάζεται με το St. Francis και το North Shore University Hospital. Το πλήρες εξοπλισμένο μας ιατρείο προσφέρει όλες τις θεραπείες εγγυακών παθήσεων, διαγνωστικούς υπερήχους όλων των αρτηριακών και φλεβικών ασθενειών, θεραπεία της φλεβίτιδας με λέιζερ και σκληροθέραπη με εξαιρετικά αποτελέσματα και επεμβάσεις που προσφέρονται στο άνετο περιβάλλον μας. Ο Dr. Πατέτσιος και το προσωπικό μιλούν ελληνικά. Για ραντεβού επικοινωνήστε στο 516 570 6818.
Είμαι πολύ επερήφανος που προσφέρω τις υπηρεσίες μου στους ανθρώπους που υποφέρουν. Κάνω το καλύτερο, εύχομαι υγεία σε όλους.
Το United Brothers Fruit Market, γωνία 30 Avenue και 33ος δρόμος στην Αστόρια, έχει όλα τα εποχιακά κυπευτικά, τόσο φρέσκα και λαχταριστά, σαν να βγήκαν από τον κήπο σας. Ανοιχτό 24 ώρες καθημερινά, σε 4.000 τετραγωνικά, προσφέρει μεγάλη ποικιλία από φρέσκα φρούτα και λαχανικά στις καλύτερες τιμές. Και τώρα, αποκλειστικά για το United Brothers Fruit Market, τοπικές φάρμες στο Long Island και Upstate New York θα παράγουν για μας εποχιακά φρούτα και λαχανικά, όπως ραδίκια, αυλίτα, σέσκουλα, ντομάτες, φασολάκια, αγκινάρες, κουκιά και όλα τα φρέσκα μυρωδικά. Ροδάκινα με γεύση Ελλάδος και 11 ποικιλίες μήλων στο Apple House μας. Στο κατάστημά μας συνεχίζουμε να προσφέρουμε άριστη εξυπηρέτηση, καθαριότητα, τιμιότητα και εξαιρετική ποιότητα και για τους πελάτες μας. 15 λεπτά πάρκινγκ δωρεάν. Και μην ξεχνάτε, το United Brothers, γωνία 30 Avenue και 33ος δρόμος στην Αστόρια, ποτέ δεν είναι αργά, γιατί είμαστε πάντα ανοιχτά.
Let's check back in with Dr. Kaporis now for some important information concerning skin cancer.
Hi, I'm Dr. Athena Kaporis, a board-certified dermatologist, and I want to talk to you today about skin cancer, what you can do to prevent it, and what you can do to look out for it. The first thing is that everyone should get a baseline skin exam by a board-certified dermatologist. The second thing is that you should know, and we say in medicine, you should know your lumps and bumps, you should know your moles. Everyone should do a self-examination of their skin so that they recognize their moles, and then once you have an understanding and recognize the type of moles that you have, you can then start to recognize should a mole change. The type of things that we look for when we're looking at moles is that we look for a mole to be evenly pigmented. When you have a mole, you want to see an even shade of brown throughout the mole. You want to see a symmetric shape like an oval or a round shape. And you want that mole to kind of match the other moles that you have. Signs that a mole may not be doing well and may need further evaluation is if the color begins to change, if the mole begins to grow, if the mole begins to bleed or to change in some other way, then that mole has to be checked. The other thing we look for is a mole that doesn't match. If you tend to have light brown moles and then one day you notice that you have a very, very dark black mole and it doesn't seem to match the family of moles on your body, then that needs evaluation. The evaluation of moles is important because if a mole becomes cancerous, it would turn into something called a melanoma, and melanomas can kill. They are fatal. The incidence of melanoma is on the rise, and this is why we advocate a full skin exam by a board-certified dermatologist and an awareness. Everyone should be aware of the spots on their body. Another type of skin cancer that's actually very common. It's the most common It's the most common cancer in the U.S., but luckily it doesn't really kill people. But the non-melanoma skin cancers, the basal cells and the squamous cells, are really quite common. These usually present as either a pink bump or a bump that scabs, it doesn't quite want to heal, it keeps recurring, or it keeps flaking. If you notice a lesion that's like a pink bump that you didn't have before, or a bump starts to scab, scale, doesn't quite want to heal, that should be evaluated as well. These type of skin cancers are usually very easy to treat, and it's important to treat them early because it's easier to treat them when they're small. As they get bigger, treatment of these type of skin cancers can result in a larger defect that might be a little more difficult to repair. And therefore, if you notice something changing, bleeding, scabbing, not quite healing, it really should be brought to the attention of your dermatologist.
Κοπιάστε για καταπληκτικό φαγητό. Κοπιάστε για γνήσια κυπριακή κουζίνα. Κοπιάστε για ζωντανή μουσική κάθε Παρασκευή και Σάββατο. Κοπιάστε. Αναλαμβάνουμε και κοινωνικές εκδηλώσεις στην ανανεωμένη αίθουσά μας. Τώρα και free delivery. Κοπιάστε στο 2315 31 Street, Αστόρια, με τηλέφωνο 718 932 3220.
Homeric Tours. Πάντα κοντά στην ομογένεια, πάντα με χαμηλότερες τιμές. Homeric Tours, το γραφείο παράδοση που επί σειρά ετών φροντίζει τον Έλληνα ταξιδιώτη με υπευθυνότητα και του προσφέρει ασφάλεια και άνεση στα ταξίδια του. Homeric Tours, το Α και το Ω για τα ταξίδια σας. Για πληροφορίες και κρατήσεις θέσεων, τηλεφωνήστε στο 212 753 1100.
And don't forget your annual calendar of health that should include checkup with your primary healthcare provider, women annual checkup with your gynecologist for a mammogram, pap smear, pelvic exam, and HPV screening. Men over 50, screening of the heart, prostate, and colon. And finally, see your doctor if you experience any pain in your body that persists.